Dental implants are something that have been around for a very long time. In fact, probably over 1,000 years. I would never do a dental implant, though, without taking a cone beam CAT scan. What is that? Well, it's a three-dimensional image of the jaw. It's important that we see the width, the height, and the overall circumstance in which we're going to be placing this dental implant. We want to know where the nerves are. We want to know where the sinuses are. We want to know where blood vessels are. And it also helps us to pick the right size of dental implant that we will use. Doing a dental implant is a fairly easy procedure. What we need to do after we've determined the size of implant that we're going to place, we go ahead and we numb the patient appropriately. Then we elevate a small flap in the immediate area where we're going to be placing that dental implant. Then we use a series of really small drills with a lot of irrigation. And then we go to the certain depth that we need to create a space sufficiently large that we can place the dental implant in. We typically then slowly put the implant in and then go to the crest or the height of the bone. That's our 12mm implant. And there we take another X-ray to make sure the implant is seated properly and in the position we are desirous to achieve. With a dental implant, there's no need to take it out. When it goes in, it is in. And it, in essence, replicates the root of the tooth. And then, as the bone grows around that dental implant, after a period of about 3 months, we can go ahead and we place a crown on top of that dental implant. And just like Mother Nature had intended, we now have a fully functioning tooth. We'll see you in a week, follow up, see how you're doing. Okay.